Hello and welcome. Today we're going to talk about mitral valve stenosis. There's no time to waste. Let's get started. Alright, so mitral valve stenosis is characterized by narrowing of the mitral valve, and as a result, blood flow from the left atrium into the left ventricles is restricted, leading to an increased pressures in the left atrium. So mitral valve normally has an area of about 4 to 6 square centimeter. If the area is reduced below 2 square centimeter, then we're going to begin to observe a turbulent as well as a resistant flow across the stenotic mitral valve. In fact, if the area is less than 1 square centimeter, this is considered a significant stenosis. This disorder is primarily caused by rheumatic fever. Now, considering this heart, if there is a severe mitral valve stenosis, then the key word is pressure overload within the left atrium, simply because the left atrium is not able to empty its content into the left ventricle during a left ventricular diastole as a result of the stenosis or the obstructed mitral valve. And so there is pressure increase within the left atrial compartment. At some point, that pressure becomes very overwhelming, and so it is going to be relayed or transferred into the pulmonary veins. So what we are saying is that there is an obstructed mitral valve and it leads to left atrial pressure increase. That pressure is then transferred to the pulmonary veins, which can also be transferred to the pulmonary capillaries. Inside the pulmonary capillaries, there can be an increase in the hydrostatic pressures, which can filter the fluids into the interstitial space. So there can be vasoconstriction, pulmonary hypertension, and in general, pulmonary congestion. So it is not uncommon to find patients with mitral valve stenosis complain of shortness of breath, cough, hemoptysis, as these are signs of pulmonary congestion. So we can actually note that left atrial contraction takes longer. It does so because of it is trying to overcome the resistance. So atrial contractions takes longer in this situation. At some point, with that increase in pressure, there's going to be a left atrial enlargement. This is going to change the architectural structure of the atrium, and so electrical conductance is also going to be impaired. And so there can be an atrial arrhythmias in general, but I would like to mention atrial fibrillation as this may be encountered in mitral valve stenosis. So if you put these two together, the enlargement plus atrial fibrillation, this poses a risk or can predispose the patient to systemic embolisms, which is very, very important. Now, often patients may tell you that when they exercise, the symptoms get worse. So during events such as exercise, when there is, say, fever, when there is tachycardia, when, say, the patient is pregnant, these scenarios can actually increase the flow across the obstruction. And so what happens is that you have actually shortened diastolic filling. Once you shorten diastolic filling, then you are actually further increasing the pressures inside the left atrium. And so the symptoms are certainly going to get worse with such scenarios. So that's very important. And after the left atrium has lost its kick, that is the contraction, there is going to be a low stroke volume, and that is going to lead to a decline in the cardiac output. So some patients may present with malar flash, that is, their cheeks becomes red. This is because of a chronic hypoxemia, and it is also as a result of the decline in the cardiac output. So it's a cutaneous vasodilation and the chronic hypoxemia. It leads to that sort of red cheeks of patients with mitral valve stenosis. Again, when the pressure builds and builds, then it can eventually be also relayed to the right heart chambers This can cause a right ventricular hypertrophy, for example. The apex beat in an isolated mitral valve stenosis is often non-displaced. But if mitral valve stenosis coexist with different valvular impairments, then the apex beat may be displaced. So on auscultation, there are three components that we have to know. And again, this evolves from the excessive left atrial pressure buildup. So taking a look at this diagram, what we see is the first heart sound, which occurs when the mitral valve closes. This marks the beginning of systole. We can also see S2, which is the second heart sound, which occurs when the aortic valve also closes. This actually marks the beginning of diastole. And again, as we said, the pressures here are very high. The pressure can stretch the mitral valves for quite some time, so that during the initial phase of diastole, those pressures we mentioned can snap the mitral valve open. And so we're going to call that opening snap. This is the first component that I want you to know. Okay, so as you can see, that occurs at the early phase of diastole. The pressure is strong enough to snap the valve open. Further from there, we can see a decrescendo diastolic rumble. Okay, so this is another important thing that I want you to know. So there is a decrescendo diastolic rumbling, which is a diastolic murmur. That is the second thing you have to mention. And if the mitral valve stenosis is very critical, then you can even appreciate an accentuation getting to the presystolic phase. So there is an opening snap, there is a diastolic rumbling, a murmur, which is actually in the middle to the late stage, as you can see. So it's a mid to late diastolic murmur. And then the S1 sound that follows is going to be very loud. This is the third thing that I want you to know. Clinical features. So mitral valve stenosis can manifest with a range of symptoms, including shortness of breath, cough, and hemoptysis. And in fact, these symptoms can even get worse when patient tries to exercise, when patient is pregnant, when there is a tachycardia, or when there is fever. Now, these events can increase the flow across the obstructed mitral valve. It further increases the left atrial pressure, and it will shorten diastolic filling. So because of that, it can worsen the symptoms. Further, as the condition progresses, heart failure can also occur, leading to orthopnea and paroxysmal nocturnal dyspnea. There is also a potential chest pain, atrial arrhythmias, and systemic embolism. Additionally, signs of right ventricular failure may also be present. In fact, it is essential to consider mitral valve stenosis as a differential diagnosis when right ventricular hypertrophy is present. We may also see malar flash in severe mitral stenosis, as you can see right there on the cheeks. These are signs of a decreased cardiac output. Investigations, and this typically involves a combination of electrocardiogram, chest x-ray, echocardiogram, and a cardiac catheterization. An electrocardiogram may show signs of atrial fibrillation, left atrial enlargement if the rhythm is sinus, and a right ventricular hypertrophy. An echocardiography may provide a diagnostic value by providing direct measurements of the mitral valve area. And if you recall, we said if the area is reduced below 1 square centimeter, and this is considered critical or a severe mitral stenosis. It is also able to provide information on the leaflet, that is thickness, its mobility, the presence of calcifications, and vegetations. Additionally, it may provide information on the left atrial chamber enlargement. With the help of a Doppler, the echocardiogram is also able to assess pressure gradient severity. Again, it's very important to exclude certain diseases that may mimic mitral stenosis, and this may include a myxoma, a thrombus, and a cold triatum, which is a congenital heart defect. Chest x-rays. This may also reveal the double density sign, which is indicative of an enlarged atrium. There may also be signs of mitral valve calcifications, Pulmonary edema and pulmonary congestion signs may also be noticed. In addition, cardiac catheterization may also be necessary to assess the pulmonary capillary wedge pressures. It is also useful to if there is a concomitant ischemic heart disease, pulmonary hypertension, multiple valvular diseases, and a previous valvotomy. All right, so let's discuss the management plan. The treatment of mitral valve stenosis focuses on addressing factors that actually increases the left atrial pressure. For example, it is not recommended to engage in vigorous physical activities if there is a moderate to severe mitral stenosis. Treat infections promptly, as fever can exacerbate symptoms. Counsel and educate women with mitral stenosis as to what they can expect when they get pregnant. The management plan may also involve reducing the preload and alleviating pulmonary congestion through the use of diuretics. Regarding atrial fibrillation, rate controlling agents such as beta blockers, non-dehydropyridine calcium channel blockers, and digoxin may also be used. In cases of hemodynamic instability, a synchronized DC cardioversion may be indicated and should be accompanied by an adequate anticoagulation 3 weeks prior to the procedure, or an alternative is a transesophageal echocardiogram to minimize the risk of systemic embolization. This also applies to chemical or pharmacological cardioversion. So anticoagulation is very important for patients with mitral stenosis and valvular atrial fibrillation. Preferably, this is done with warfarin. Other prophylactic measures are also crucial aspect of managing mitral stenosis, and here antibiotics may be necessary to prevent recurrent rheumatic heart diseases and infective endocarditis. So in cases of mitral valve stenosis, surgical intervention may also be necessary if medical therapy is ineffective, and especially if this results in a functional class 3 despite adequate treatment. This may include situations where patients experience, for example, recurrent embolizations, pulmonary hypertension, or failure of balloon valvulotomy. In these scenarios, surgical options such as mitral valve replacement or a mitral valve commissurotomy may provide effective relief from symptoms. However, balloon valvuloplasty is considered the standard of care. Thank you, and I hope this was useful. If you enjoyed it, then hit the like button and subscribe to the channel. Bye.